What is osteoporosis? Osteoporosis is a health condition that weakens bones, making them fragile and more likely to break. Osteoporosis is more likely to occur in people who have a low calcium intake, eating disorders, and gastrointestinal surgery. Osteoporosis causes bones to become weak and brittle, so brittle that a fall or even mild stresses, such as bending over or coughing, can cause a fracture. To prevent osteoporosis, quit smoking, limit alcohol consumption, maintain a healthy weight, eating a well-balanced diet, and stay active.
Assalamualaikum. Today I'll be talking about osteomalacia. Osteomalacia, otherwise known as soft bones, is a disease where the bones become weaker and causes the bones to break more easily. Osteomalacia is a disease where the bones break down faster than it can reform, and this disease usually occurs in adults. Osteomalacia is caused by lack of vitamin D, usually from not getting enough sunlight. Less frequently, osteomalacia is caused by digestive or kidney problems. Vitamin D is an important nutrient for calcium absorption and maintaining bone health. There are also rare genetic conditions that cause osteomalacia. The symptoms of osteomalacia also include pain in bones and hips, also bone fractures and muscle weakness. Patients that are diagnosed with osteomalacia can also have difficulty walking. The treatment for osteomalacia is with vitamin D, calcium and phosphate supplements intake depending on the individual's case. Also, wearing braces to reduce bone irregularities, and in some severe cases, surgery needs to be done to correct bone deformities.
Assalamualaikum. Today I will talk about arthritis. Arthritis is a disease that affects your joint. Arthritis usually involves inflammation or degeneration of your joint. These changes can cause pain when you use the joint. Different types of arthritis can have different causes. For instance, gout is the result of too much uric acid in your body. But for other types of arthritis, the cause is unknown. You may develop arthritis if you have a family history of arthritis, have a job or play a sport that put repeated stress on your joint, or have certain autoimmune diseases or viral infection. Some factors make you more likely to develop arthritis, including age. The risk of arthritis increase as you get older. Lifestyle, smoking or lack of exercise can increase your risk of arthritis. Sex, most types of arthritis are more common in women. And weight, obesity put extra strain on your joint, which can lead to arthritis. The most common sign and symptom of arthritis involve the joint. Depending on the type of arthritis, sign and symptom may include pain, stiffness, swelling, redness, and decreased range of motion. Currently, there are no cure to arthritis. However, you can lower your chances of developing arthritis by avoiding tobacco product, doing low-impact non-weight bearing exercise, maintaining a healthy body weight, and reducing your risk of joint injuries.
So in my part, I will explain about scoliosis. Scoliosis is a sideways curvature of the spine that most often is diagnosed in adolescence. Scoliosis can occur in people with conditions as cerebral palsy and muscular dystrophy. The cause of most childhood scoliosis is unknown. Most cases of scoliosis are mild, but some curves worsen as children grow. Severe scoliosis can be disabling, and especially severe spinal curve can reduce the amount of space within the chest, making it difficult for the lungs to function properly. For the symptom, the person will have uneven shoulders, also one shoulder blade that appears more prominent than the other, uneven waist, one hip higher than the other, and a prominence on one side of the back when bending forward. For the last one side of the rib cage jutting forward. Most scoliosis cases, the spine will rotate or twist in addition to curving side to side. This causes the ribs or muscles on one side of the body to stick out further than those on the other side. Doctors don't know what caused the most common type of sclerosis, although it appears to involve hereditary factors, because the disorder sometimes runs in families. Less common type of sclerosis may be caused by certain neuromuscular conditions such as cerebral palsy or muscular dystrophy. Birth defects affecting the development of the bones of the spine. Previous surgery on the chest wall as a baby, injury to or infection of the spine, also spinal cord abnormalities. The effect of sclerosis, it causes visible skeletal deformities, interferes with signal from your nervous system, results in painful muscular imbalance, also interrupts your digestive process, and will reduce your cardiac output and respiratory capacity. And the last one can impair your mental health. Sclerosis is often easy to treat when it diagnosed early. Sclerosis prevention is not possible. Even activities like practicing good posture, exercising, and doing yoga or Pilates cannot prevent sclerosis. The only type that may be prevented is adult sclerosis caused by osteoporosis. Many cases of sclerosis do require treatment. For moderate to severe cases, treatments can help prevent sclerosis from getting worse and relieve other symptoms such as pain. So that's all.
Okay, hai. Nama saya Irfan dan hari ini saya nak bentangkan tentang masalah kesihatan yang berkait dalam sistem urinari dalam bab 13, iaitu masalah batu karang. Jadi, apa punca yang menyebabkan terjadinya kidney stone? Kidney stone terjadi apabila urin anda mengandungi lebih banyak bahan pembentuk kristal seperti kalsium, oksalat dan asid urik. Pada masa yang sama, air kencing anda mungkin kekurangan bahan yang menghalang kristal-kristal tersebut untuk melekat bersama, mewujudkan persekitaran yang ideal untuk batu karang terbentuk. Jadinya, batu karang yang dihasilkan dalam buah pinggan itu akan memasuki saluran ureter yang kemudiannya akan sekat dan menghalang urin dari memasuki pundi kencing di bahagian ureter dan uretra. Maka disitulah akan terjadinya kesan-kesan kepada kita. Antara kesannya ialah kita akan mengalami kesakitan di bahagian abdomen ataupun groin. Macam saya, groin tu, lelaki akan sakit di bahagian testikel. Kita juga akan mencecah suhu yang tinggi macam nak demam dan akan kerap berpeluh. Selain itu, kita juga akan merasa sakit ketika kencing, bermuntah-muntah dan menyebabkan infeksi urin kerana urin dalam pundi kencing tersekat. Jadi bagaimana caranya untuk menghadapi masalah kidney stone ni? Cara yang terbaik untuk menghindari batu karang adalah dengan minum air kosong yang lebih untuk mengelakkan dehidrasi. Malah teh dan kopi juga termasuk, sebab dua tu boleh bantu dalam menghindari kristal-kristal untuk terbentuk. Anda juga boleh menambah jus lemon yang segar ke dalam air. Mengelak daripada mengambil minuman yang bergas. Kita juga mestilah kurangkan pemakanan yang garam supaya tak terjadinya kristal-kristal di dalam buah pinggang kita. Okey, seterusnya berikut ialah sumber-sumber yang berkaitan dengan masalah batu karang.